We welcome you to this session. This session is a part of the series Udyamita Ki Or. This is a fortnightly series of teleconferencing sessions where entrepreneurial opportunities in specific subject areas or sectors are discussed. The invited experts provide information about the existing innovations and startups in a particular area, possible entrepreneurial opportunities and funding available in that area. The initiative is brought to you by National Center for Innovations in Distance Education, IGNOU. The objective is fostering a spirit of innovation and entrepreneurship among students and faculty in the university. The session is held on 2nd and 4th Wednesday every month from 3 p.m. to 4 p.m. So far, we have had sessions on innovation and entrepreneurship opportunities in allied biological sciences, poultry sector, waste management, food processing, and disability sector. In today's session, which is the 7th episode of the series, we will discuss the opportunities for startups in health sector. Digital healthcare sector or healthcare technology is one of the fastest growing sectors in India. While healthcare has become much more accessible, the large population and overloaded healthcare infrastructure are the major challenges faced by the healthcare sector of the country. The demand for innovative healthcare technology and solutions is enormous. Indian healthcare technology startups are thriving to fill in the gaps left by traditional healthcare ecosystem. Also, there is a strong focus on the adoption of artificial intelligence and machine learning for providing their services. Today, we have with us Professor Ruchika Kuba, Director, School of Health Sciences, IGNOU. Dr. Ruchika has a rich experience in health sciences. She has been actively involved in the design and coordination of various innovative programs for the university in the area, such as geriatric medicine, healthcare waste management, endodontics, implantology, dialysis medicine, clinical cardiology, and many more. We welcome you to this session, Dr. Ruchika.
Thank you.
We also have with us Dr. O.P. Sharma, Director, NCIDE, IGNOU. He is an expert in the area of innovation and startups. We are pleased to have you with us in this session. Healthcare is emerging as a promising and viable entrepreneurial option. Patients and doctors are increasingly adopting technology in healthcare. The fitness industry has also shown an increase in the use of technology. The adoption of artificial intelligence and machine learning has amplified the overall value of healthcare in patient diagnosis, treatment, and monitoring. Healthcare enables young entrepreneurs to impact the world positively by saving lives or improving people's quality of life. To start the discussion, I would request Professor Ruchika Kuba to please tell us about the possibilities of innovation in the healthcare sector. Dr. Kuba, please.
Thank you, Dr. Sujata, for introducing me as well as the subject and for giving this opportunity for me for coming here. So, to begin with, I would welcome, I'm sure we have a lot of our health sciences students today in this program, so welcome all of you, and very happy Vasant Panchami as well as happy Valentine's Day. And I think it is probably, we are fortunate to have you with us on this day, spending some time of your day with us on this Valentine's Day and Vasant Panchami. So I will be talking about innovations and startups in health sector. So if we just take the WHO definition of innovation is for something new, better and more effective ways of solving problems is what is the definition of innovation. And why do we need innovation? So especially if I am talking about with respect to health sector, to improve efficiency, maybe to improve the affordability. Anything that we bring in should be safe, it should be sustainable, very important, because if we bring in something which is not going to last long, it's very short-lived, then all the effort and energy going into innovation gets wasted. It should have some use and it should be effective. So the ultimate goal of health innovation is to meet the public and personal healthcare needs and demands for optimizing performance of the health system. So now I think I will also share with you the various innovation and startup opportunities that are available. I will request our studio to please focus on the presentation. So there are various areas in which the innovation and startup opportunities are available. And can we have the slides, please? Thank you. So we can have in health policy, various practices, the systems available in the health sector, products, which is a very important thing, especially for the startups also. Technology, as Dr. Sujata rightly said, that in fact healthcare is the largest sector where technology is now being used for optimizing healthcare, for bringing quality of life and patient satisfaction. Then we have services, we have delivery methods and patient satisfaction. I will not cover all the areas because we want you to ask questions, and if the studio can also scroll the phone numbers, then maybe we can have few questions on whatever you feel, or you want to contribute. So I'll just take three areas. One is how we are transforming healthcare policy through the innovative startups. For example, you are all aware about blockchain for securing health data exchange. So a lot of data is being exchanged, digitally. All your health care information, all your investigations, all the previous records of your medical consultations can be uploaded in the website, but it is very important that it should reach only to those for whom it is intended, that is maybe the physicians whom you contact. So securing this data, this large amount of data, is very important. Then AI, you are all aware about artificial intelligence. We can have solutions for personalized medicine, telehealth, you are all aware of telemedicine, telehealth, and data analytics for evidence-based decision making. Then we have transforming health processes. This includes the medical tourism, using alternate medical services, home healthcare services, and virtual therapy and mental therapy. Especially during the COVID, you may have realized that there was so much of support, psychological support in the form of virtual therapy for mental health, which was given. Even the consultations for the normal consultations were also held through online mode. So this was another transforming health processes through innovations. And then the health products, which I'll come in detail more. Various organizations, various big companies have come up with so many health products. Like simple ones are wearable watches. We have the temperature regulating base layers and socks, especially for those people who have to go in the high mountaineering areas. And then we have pendants, wristwatch for activity tracking and alerts.
Ma'am, could you please tell us some of the innovative initiatives existing in the field of healthcare?
Yeah, so as you said that innovation and startups are two different things. Innovation is a great idea that comes to your mind, and so you can have, that idea itself. You can display it, you can, copyright it, and then you have startup where you think of a business plan, how to go ahead. So some of the examples of, especially this is in relation to the programs that we are offering from health sciences. I'll just give you a few examples. So like we have a waste segregator. Now that can identify the type of waste and sort it into bins automatically. So how does this happen is basically there's a conveyor belt, and in the conveyor belt you put all the waste. And, with the help of identifying the temperature, maybe identifying the content, for example, metallic contents, because they are magnetic. So using the properties of the material, liquid is there, so liquid waste can get separated. So using the temperature, pressure, the humidity, moisture, and the metallic content, the conveyor belt keeps moving and the sensors pick up the specific waste and then they place it into different containers. Similarly, we have a robotic arm sorting that can identify the type of waste and sort it into the bins automatically. I'll just show you. I'll go to the YouTube. This I had actually embedded in this, but unfortunately it was not working. So I'll just start and maybe you can just see. See, this is the robotic arm, and they have just put, you know, on paper something. They have put on paper something where the moisture, the temperature is being has been placed in the paper, and so you can see the different categories are being sorted out and segregated by this arm. Now similarly we have smart containers. Now smart containers is another thing. As I told you, the conveyor belt was taking charge, and it was, you know, through the conveyor belt you were sorting it out into different containers. Similarly, you can have containers, you know, which will give the signal to the storage room or to the place where collection room is there. So when it is 3/4 filled, the 3/4 filled sends the signal to the collection room, and the collection room will come and pick up those containers. Suppose the container is not fully filled, but the people have come for collection, then it's a smart container. So what it does is that it will close its lid. It will not allow it to be collected. So these all are very, very small ideas which you people can also, you know, build up. These are very innovative ideas. You don't need a big company or big infrastructure to build up innovations or startups. These are very small things which can be intelligently thought of and done. Similarly, this, I'm sorry, but the video is not working, but this is a baby activity sensor. So what happens is that you just place a small, the sensor on the baby's diaper. This can be done for elderly also, for babies also. So wherever the baby is moving, you have the sensor can be identified, and this can go on your phone, it can go on your laptop. So, you know, if you are in a workplace and your elderly you have left at home and you have put this sensor, so you can see from your computer itself that whether the elderlies are all right, where they are moving, have they moved to the kitchen, are they all right, they have not fallen. So all that can be done. Now this is again a 3D printing. I hope that all of you realize that 3D printing doesn't mean that it's actually printing in a 3D manner. It basically means how to make the precise and custom designs which can be made. For example, the burn victims also, we can have the, you know, the skin which can be produced, and we can make a 2D X-ray or a 3D scan into a 3D model. So we get the template of what needs to be prepared. For example, there's a fracture of a skull. Now a part of the skull has been fractured. You want to prepare a bone transplant kind of a thing, or a bone template which can be fitted into the skull of the person. So you, through the 3D printing, you get the 2D image and then you get it printed. So that is how this works. So should I talk about the startups also?
But before taking the startups, we would like to put a question to Dr. Sharma. Are some of the IGNOU students also doing some innovations in the healthcare sector?
Yes, Dr. Sujata, IGNOU students are also doing a lot of innovations in different sectors, including the health sector. I think we can invite one by one students after break. That will be a good thing because some of them will be connecting with us. But IGNOU students are taking part in a different way, like identifying the problem areas, particularly if we talk about the health sector. What you have highlighted, the important thing is to identify the gap areas. What are the gap areas where this kind of innovative initiatives are required? And once you take innovative initiative, it is worth commercialization that can be converted into a startup also. So that kind of initiative our students are also taking place. And I would like to suggest one thing to our students as well as all the viewers कि जब हम हेल्थ सेक्टर की बात करते हैं तो उसमें हमें ये ज़रूर देखने की ज़रूरत है कि आपकी एक्सपर्टाइज और इंटरेस्ट क्या है. अगर आपकी एक्सपर्टाइज और इंटरेस्ट है टू वर्क इन द फील्ड ऑफ हेल्थ सेक्टर, तो सबसे पहला काम आप ये करिए कि अपने उन एरियाज़ को आइडेंटिफाई करिए जहाँ गैप एरियाज़ हैं या जो नीड बेस्ड हैं. कहाँ कहाँ पे ऐसे अभी ऐसी ज़रूरत है कि जो कि आप चाहे वो पेशेंट के साथ कनेक्ट करने की बात हो, एक्सेसिबिलिटी इंक्रीज करने की बात हो, या उनको अवेयरनेस क्रिएट करने की बात हो, या हम कहें कि टेक्नोलॉजिकल इंटरवेंशंस की बात हो, जो भी एरियाज़ हैं, फर्स्ट यू आइडेंटिफाई दोज एरियाज़ एंड देन ट्राई टू सी कि आपकी एक्सपर्टाइज कौन से एरिया में है, और अकॉर्डिंगली आप अपना उस प्रॉब्लम पे एक सॉल्यूशन आइडेंटिफाई करिए एंड देन वर्क अपॉन दैट. सो आई विल टॉक अबाउट द इनोवेशंस बाय इग्नो स्टूडेंट्स. इनोवेशंस में जैसे हमारे एक क्योंकि मैं आपको बताऊं कि इग्नो अपने स्टूडेंट्स को आइडेंटिफाई करने के लिए एक स्कीम है जो कि आइडिया कंपटीशन है, बेस्ट इनोवेशन अवार्ड है, बेस्ट स्टार्टअप अवार्ड है, इस तरीके की स्कीम्स हैं. थ्रू देम वी आइडेंटिफाई द इनोवेटर स्टूडेंट्स, और फिर उनको हम मेंटर भी करते हैं, नर्चर भी करते हैं. इन आई थिंक इन 2019 3 स्टूडेंट्स दे वर गिवन द बेस्ट इनोवेशन अवार्ड. उनमें से एक हमारे थे डॉक्टर अनिमेश मोहन. दैट टाइम ही हैड डेवलप्ड एन इनोवेटिव प्रोडक्ट. वो इनोवेटिव प्रोडक्ट जो नी जॉइंट्स हैं अपने, उनसे रिलेटेड जो पेन होता है, ही विल बी कनेक्टिंग विद अस, ही विल टेल अबाउट दिस. उसके ऊपर उन्होंने एक इनोवेटिव डिवाइस डेवलप किया. एंड लेटर ऑन, बिकॉज ही बिलोंग्स टू आयुर्वेदिक फील्ड, ही इज MD in Ayurveda, he has developed now a startup also. So that is a kind of initiative one can take from idea to innovation and then convert that into a proper startup means to commercialize. So this kind of initiative our students are taking place.
And suppose a student has an innovative idea, so how can that student take it till startups if he is interested, he or she is interested?
Okay, so this is I'll talk about the startups later, but I'll just carrying forward what Sharma ji has said, that how to innovate or how to do a startup. So the first step is, if I can have the slide, is you must identify a problem. जैसे शर्मा जी ने भी बोला कि क्या एक कोई problem या opportunity है किसी भी system में where you are working and you find that there is a problem. So you identify them and then you do a design innovation. Now what is design innovation? Very important, as Sharma ji also said, कि एक नीड भी होनी चाहिए. आपको एक प्रॉब्लम दिखी, लेकिन क्या वो नीड है, मार्केट की नीड है क्या? नहीं तो क्या होगा, आपको प्रॉब्लम दिखी, आपने सोल्यूशन ढूंढ ली, एंड दैट्स द एंड ऑफ द मैटर. इट विल नॉट गो फॉरवर्ड. योर इनोवेशन विल नॉट गो फॉरवर्ड फॉर एनी बिजनेस आइडिया और फॉर स्टार्टअप. सो यू नीड टू सी वेदर इट इज डिजायरेबल बाय द मार्केट, बाय द पीपल, बाय द कंज्यूमर, वेदर इट इज गोइंग टू बी फीजिबल. आपने तो सोच लिया ये करना चाहिए, लेकिन क्या आप कर सकते हैं? क्या आपके पास रिसोर्सेज हैं? क्या आपके पास मनी है? क्या आपके पास एक्सपर्टाइज है? एवरीथिंग शुड बी देयर. एंड देन वेदर इट इज वायबल. वायबल मीन्स इवन सस्टेनेबल होगा, बिजनेस के वे से आगे जा सकेगा कि नहीं. So these are the gears of innovation, gears of design innovation which have been brought about, जिसमें हमें सब कुछ देखना होता है. Desirability and problem fit को proof of value, whether it is going to have any value, proof of concept, that is solution fit होना चाहिए. The solution should fit into the problem, and then there should be a growth fit, that is it should go for viability, it should go into the market, and there should be a proof of impact कि एक at least you are bringing in a change, कोई फायदा हो रहा है, जो आप कर रहे हो उसका कोई फायदा भी होना चाहिए. ये नहीं है कि ठीक है people want it but is it useful. So after you have evaluated this, you can develop a prototype and then test the prototype. And after testing the prototype, then you go in for a business plan. So it is a long journey from identifying a problem to reaching a business plan, scaling, sustaining. And if you talk to entrepreneurs, which I think NCIDE is going to get in after the break, so you will learn from them that every entrepreneur is not successful, and every entrepreneur doesn't get success in his first idea. Every entrepreneur does not get success immediately. So it may take some months, for some it may take years. Sometimes you work for 2 years, 3 years on one idea, it doesn't go into a business plan. So you need to leave that idea. Maybe you start again and you come to another business plan. So these are the hurdles. The best thing to know is that you should not get disheartened क्योंकि आपका idea fail हो गया. The more important thing is that you need to do good planning. जब तक अगर आपका planning stage पे आपने effort नहीं किया, आपने ideas को लेकर research नहीं किया, so researching into the marketability of the idea is very, very important. So this is what is important, I think.
So what could be the factors that affect the success of any innovation that is taken up?
Yeah. So as I was saying that सबसे पहले you need to see who are the players. To whom are you innovating? So whether the doctors are involved, technology providers are involved, insurance companies are involved, and then very important is, as an individual you will not be able to carry forward your innovation. Maybe you think of a solution, But to bring the solution into the market, to scale it up, to be able to bring it into a business plan, you will require funding. Even sometimes for innovation also you may require funding, because sometimes the technicality or the technology that is involved is so great, costly, that you may not be able to do it on your own. Then there may be policies.
There is a call from a student, so let us.
गुड आफ्टरनून मैम. हेलो
Yeah. Good afternoon.
मैम.
Yes, please.
मेरा ये डाउट है कि मैम मेरे रीजनल सेंटर पे ये कोर्स अवेलेबल नहीं है, तो मैं अगर मैम कोई दूसरा रीजनल सेंटर चूज करता हूँ लेकिन एग्जाम अपने रीजनल सेंटर में ही कोई सेंटर पे देना चाहूँ तो वो पॉसिबल है या नहीं?
Can you come again? Which program are you talking about? Hello.
आप दोबारा अपने प्रश्न को कहेंगे क्या प्लीज?
हेलो.
यस, हाँ, दोबारा कहिए.
जी 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 सर, मैं ये कह रहा था सर कि मैंने एक मास्टर्स डिग्री में एडमिशन लिया है, मैं एक
कौन से
सर्टिफिकेट,
मास्टर्स डिग्री में? दैट इज इम्पोर्टेंट.
मास्टर्स इन इंग्लिश.
ओके.
And ma'am, that admission has been successful, but I want to know that other program I want to take up registration in another certificate course, but मैम वो सब्जेक्ट मेरे रीजनल सेंटर पे अवेलेबल नहीं है, तो मैं अगर दूसरा रीजनल सेंटर लेता हूँ एंड एग्जाम अपने रीजनल सेंटर में देना चाहूँ तो वो पॉसिबल है या नहीं?
ये सेशन इसके लिए फोकस नहीं है. यू कैन आस्क क्वेश्चंस रिलेटेड टू इनोवेशन, एंटरप्रेन्योरशिप, स्टार्टअप. जैसा शुरू में बताया था कि दिस सेशन इज मेनली फोकसिंग ऑन इनोवेशन इन स्टार्टअप अपॉर्चुनिटीज इन दी हेल्थ सेक्टर. तो आपका अगर इससे रिलेटेड कोई क्वेश्चन है तो आप बात करिए, और अदरवाइज हमारे और दूसरे सेशन होते रहते हैं, उनमें आप आइए और इन क्वेश्चंस का सवाल जवाब आप ले.
ओके सर.
ठीक है. यस प्लीज. सो
Thank you. So policy is also a very important component, that whether you will be allowed to do that innovation or not, whether there is some copyright issue involved in it, whether there is some patency involved in it, whether the system of your country allows as per policy to do this or not. So that is important. And then evaluating the right time to adopt or invest in technology is equally important. So the market may sometimes not be ready for a kind of technology. So you have to make sure that the market is ready to accept your technology. So that is very important also. And then customers, that whether that this is the most important thing, marketability, that is customers, whether acceptance will be there or not. And then accountability, that is it should be cost effective, it should have long term safety, it should be sustainable, it should also be scalable. So these are some of the factors which affect innovation.
Dr. Sharma, would you like to add to this aspect?
यस डॉक्टर सुजाता, इनफैक्ट जो फैक्टर्स प्रोफेसर रुचिका ने जो बताए हैं दे आर वेरी इंपॉर्टेंट फैक्टर. लेकिन सबसे ज़्यादा इंपॉर्टेंट फैक्टर ये भी है कि आपका इंटरेस्ट किस एरिया में है, आपकी एक्सपर्टाइज किस एरिया में है. अगर आप किसी हेल्थ सेक्टर के फील्ड में काम करना चाहते हैं और टोटली डिपेंड कर रहे हैं किसी दूसरे के ऊपर, देन आई थिंक इट नॉट बी एडवाइजेबल टू गो इन दैट डायरेक्शन. एटलीस्ट यू हैव इंटरेस्ट एंड एक्सपर्टाइज इन दैट फील्ड. एंड सेकेंडली, मोस्ट इंपॉर्टेंटली, इट इज कि आप जो उस फील्ड में काम कर रहे हैं उसके टेकर्स कितने हैं, यूजर्स कितने हैं. क्योंकि जैसे प्रोफेसर रुचिका ने बताया कि आपका आइडिया बहुत इनोवेटिव हो सकता है, बहुत ही आपके लिए यूजफुल हो सकता है, लेकिन उसको यूज करने वाले बहुत ज़्यादा नहीं होंगे, तो इन दैट केस इट मे नॉट बी ए सक्सेसफुल आइडिया. तो इसलिए ये आपको बहुत ध्यान रखने की जरूरत है कि जिस भी वेंचर में आप काम करना चाह रहे हैं, आगे बढ़ना चाह रहे हैं, उसमें देखिए कि उसकी स्केलेबिलिटी कितनी है, आप उसको कहाँ तक लेके जा सकते हैं. बिकॉज देयर आर टू डिफरेंट थिंग्स. वन इज टू फाइंड ए इनोवेटिव सॉल्यूशन दैट कैन बी पेटेंटेड एंड कैन बी कंक्लूडेड एट दैट लेवल ओनली. आपने एक बहुत अच्छा इनोवेटिव सॉल्यूशन दे दिया, कोई प्रोडक्ट बना दिया, बट उसका बहुत ज़्यादा मास स्केल पे यूज नहीं हो सकता है, बहुत उसके यूजर्स नहीं है, तो वो उतना वायबल नहीं रहेगा, अच्छा नहीं रहेगा. एक दूसरा यह है कि आप इस तरीके का एक प्रोडक्ट बना रहे हैं, भले वो बहुत सिंपल है, कम कॉस्ट का है, लेकिन उसके यूज करने वाले बहुत ज़्यादा हैं, तो यू कैन ईजिली कन्वर्ट दैट इनटू ए प्रॉपर बिजनेस और स्टार्टअप. और क्योंकि जब आपको एक बिजनेस करनी है तो यू शुड हैव ए प्रॉपर रेवेन्यू मॉडल इन दैट कॉन्टेक्स्ट. सो दिस इज इंपॉर्टेंट टू बी कंसिडर्ड.
Thank you, Dr. Sharma. So, ma'am, could you please give us some examples of the startup initiatives in the field of health
So
sector?
as Sharma ji has also said कि startups कोई जरूरी नहीं और जैसे मैंने भी कहा कि बहुत बड़े हों. They have to be very technologically, having a lot of input technologically, a lot of resources are required. We can have simple startups, and I'll show you some examples of startups by big companies which are very small and great ideas. So this is an example of a Microsoft accelerator program called Healthify Me. इसमें क्या हुआ that basically started all during COVID time only, I think, in which they started with better insight of the people into their nutrition. So you have got...
There is a call from a student, so let us take this call.
Yes, please come up. हाँ, आप बोलिए क्या बोलना चाहते हैं, कौन?
Hello, sir. Dr. Animesh Mohan.
Yes, Dr. Animesh, sir.
Okay.
Animesh is our student, and he is a innovator student, as well as he has done startup also, and he was awarded with the Best Innovation Award, I think in 2019. And we are happy to have you, Dr. Animesh, with us, so you can tell about your innovation in brief and also about your startup. Because after that you have taken an initiative towards startup also. That's a good thing.
You can join on Skype.
Sure, sir. First of all, I would like to thank the organizers of the event for providing me this opportunity.
Animesh, you are not audible, first of all. And second, can you join in Skype? If you join through Skype, all our viewers will be able to see you.
Okay. So can I get the link of the Skype?
I will ask the studio people to share the link of the Skype on the screen. So you can please join. It will be a pleasure to see you, and everybody will also be able to interact with you.
Sure.
In the meantime, you can continue. You can tell us about your startup.
Okay. Myself, Dr. Animesh Mohan. I am basically Ayurveda doctor, a specialist in Panchakarma. It is one of the branch of Ayurveda. Right from my graduation, I was involved into the management part along with my medical science and the startup field. I have done some part-time courses when I was studying in Banaras Hindu University, Varanasi. And during my post-graduation, I got the opportunity to find the loopholes in the existing system and find the opportunity where we can work in a better way. So I thought of finding the solution of the problem which is most prevalent in India. It is osteoarthritis of knee. In common language, we can call it as घुटनों का दर्द और घुटनों का गठिया. In India, around 50% of the women after the age of 55 are suffering from pain of the knee joint. Although we have many available treatment in Ayurveda as well as in conventional system of medicine, ranging from simple painkiller to knee joint transplant, but that option still does not provide affordable care to the patient. So I was working on it. I started going through the research project which are done in India as well as in abroad. And by using the concepts of Ayurveda, the treatment principles of Ayurveda, I combined the modern day research with the treatment principles of Ayurveda, and I designed a new treatment. And so for that treatment, no instrument was available for application. So because of such issues, I'll have to go for designing the instrument. And after 1 year of research, I designed an instrument known as JANU Abgaha instrument. And in medical science, whenever we are working, we should have to go for a set protocol of clinical trial to prove it whether it is safe for the patient and whether it is applicable or it is effective in those patients. So we have gone for a proper clinical trial with the permission of Clinical Trial Registry of India registration, and it was found very much effective as compared to the traditional system of Janu Basti, which is followed in Ayurveda. My key concept while developing the instrument was that it should be, first of all, user-friendly and affordable. Because in India, the healthcare system is suffering from the major issue of non-availability of resources at the rural place and the high cost of the treatment. The second thing is the doctor-patient ratio in India is very, very low as required as per the guidelines of WHO. So if we design any treatment which is dependent on the doctor, so although it can be effective in the hospitals in the metro cities, but it cannot be utilized in a rural population. And whether the population, any person is from rural India or from the urban cities, they all are suffering from such disease because it is a age-related degenerative changes of the body. So we worked on making it cost-effective. We worked on making it more user-friendly by minimum use of technology and maximum use of concept. So it is not an electrical instrument. It is just a steel-based body instrument which use hot water for maintaining the temperature. Anyhow, we have used very easily available digital thermometer to make it standardized. Now we have started working on other part of the instrument, other instruments also which can be used in Panchakarma. And our startup is mainly based upon how we can make the healthcare system very cheap, affordable, and effective to the patient through Ayurveda. So there are a lot of people who are working in the conventional system of medicine, but there are very few companies which are working in the Ayurveda. We have seen like Ayurveda is being practiced from thousands of the years, and it is effective in many of the disease conditions. But from the past, many times the research in Ayurveda has been decreased, and innovation particularly is hardly done in this system of medicine. So we tried to make it more effective and prove it, clinically proven measures which can be done.
Thank you, Dr. Animesh. You have done a wonderful innovation, and we are proud of you that being IGNOU student, you are doing this kind of innovation and also converting that into a startup, because particularly using the Ayurveda and the traditional medicine system, this kind of startups are required, because that is a way to reach out to the common person, to the person in the remotest area, and to make it affordable also. So thank you very much for joining with us and also highlighting about your innovation.
So before moving ahead, we will take a short break and we'll be back after a break.
अब क्यों ब्रेक ले लिया?
Do you wish to be part of a television studio like this, or any other media system? Or already part of any media system, want to enhance a new set of skills? Welcome to School of Journalism and New Media Studies. Here in the School of Journalism and New Media Studies, we are offering program for all set of people to learn and enhance their media skills. The vision of School of Journalism and New Media Studies is to generate a new set of professionals in the area of media and communication studies with understanding about role of media in the national development and global understanding. We offer innovative programs in the field of journalism and mass communication that sets the benchmark of high quality learning and teaching process at the national level. We offer these programs across the country with the help of our regional network as well as study center. Same manner, many of our programs are offered through online mode with a sophisticated learning management system. SOHS offers programs from PhD in journalism and mass communication till certificate level. We have masters in journalism and mass communication. The eligibility is a bachelor's degree, and we are introducing this program in 3 languages: Hindi, Tamil and English. Students from national and international students can join either through online mode as well as in a distance mode. We have 4 postgraduate diploma programs, specialized areas in the field of development communication, digital media, electronic media, and journalism and mass communication program. And all these 4 programs are available in distance mode. 2 programs
We welcome you back to this session. Professor Kuba, you were telling us about startup initiatives in the field of health sector.
Yeah. Thank you. So I'm just going to quickly tell you what are the various startups. So for example, one is a Healthify Me. This was a startup which was started by under the Microsoft Accelerator program. So it is an app. And what does this app do? Basically, they have a continuous glucose monitor and a smart scale, with the help of which they will suggest you what diets to take, and they can analyze also the diets that you are taking. Then we have another thing. This is the CultFit. The CultFit was one of the first companies to provide comprehensive wellness services. So it was started as a workout app, and it provided the personalized training plans. Again, this started during the COVID time when people could not go in for the gyms and exercises. So there was personalized training plans which were prepared for individuals. And later on, with the opening of the lockdown, the on-demand offline access to the gyms, yoga and meditation sessions were also provided. So at present, it provides personalized meal tracking and nutrition apps plans also. So you can see, how it starts with a small idea and how the idea grows, and then they build in more things into that, so that it becomes a much greater plan or a bigger app to have other things. After they keep doing the market survey, they see what is the satisfaction level of the customers, and then when the satisfaction level is improving and the suggestions from the customer comes that this would have been, ye bhi aur acha hota agar isme ye hota. So after their feedback, they improve their product. So it has also expanded now to provide diagnostic tests for understanding one's current physical and mental being. So ghar baithe hue, through this app you can do everything regarding your health. Then there is a Tata Health, which Tata company had taken out. This is a customer digital health platform that offers health services to both consumers and healthcare providers. So इसमें क्या है? There's a cloud-based electronic medical record, and it has the ability to remotely reach out a doctor instantaneously. It helps to manage your appointments, prescription, billing, everything remotely. So this has been taken out by Tata. Now this is a Doxyplex, which you may be knowing as doctors, that this is a unique online platform only for clinicians, and it helps the doctors to discuss among each other, sharing experiences and talking about how they managed a difficult case and what are the treatment protocols being followed in one country, in another country. So you can stay up to date with such kinds of apps, and the treatment procedures can then be discussed, and some revolutionary ideas, some revolutionary management protocols can also be brought up in such platforms. So these are the startups that
Dr. Sharma, would you like to add to this?
Yes, these are good examples of startups that Professor Kuba has given. I would like to suggest the areas of innovation in startup particularly. What are the different areas, possible areas where innovation in startups are possible in health sector? First one, I would like to highlight the healthcare awareness, because awareness is very important for the people. There are number of apps, number of initiatives taken by the people to create awareness about the health issues, wellness, mental health, etc. So this is a very promising area where a lot of work is required. Our students can also take initiative in this direction. Another area is a healthcare delivery system. As you have rightly highlighted, delivery of the medicines, delivery of the products, health products, etc. But still much more is required, particularly to reach out the remote part of the country and rural part of the country where these urban-based startups are not reaching out. So that is an area where our students can take initiative. Another area is to develop innovative products. What Dr. Animesh had highlighted, he had given an example of a device which he designed innovatively to replace the existing one. So similarly, if our students are looking at the available devices, available products, available services, and then find out the weaknesses of those, find out the cost effectiveness of those, find out the affordability of those all things, and then come out with the solution which is a more affordable, more reachable, more accessible. So that kind of possibility is there. So in addition to that, there is a possibility of digital health care, like you have mentioned about the wearable.
Dr.
Yes.
Sharma, there is a call from Rajasthan, so let us take
Yes,
it.
yes, we can take call.
Hello.
Yes.
Hello.
Yes,
Good
please.
afternoon, respected madam or respected sir.
Good afternoon.
Good afternoon.
Madam, myself Mukesh Meena from Rajasthan.
Yes, Mr.
Yes,
Meena.
Mukesh, you talk about your startup. Mukesh is also our innovator student, and he was given the Best Innovation Award for his innovation, medical apps. Because just now I was talking about the need of innovation in the field of healthcare awareness. And Mukesh has done that kind of app development. And good thing about Mukesh is that he learnt how to develop app and then developed app in the field of medical. So kindly talk about your
Very
innovation.
good. Very good.
हाँ मैडम, मैंने जैसे सर ने बताया कि मेरी पहले फील्ड में ड्यूटी बाड़मेर डिस्ट्रिक्ट में थी, जो एक रूरल डिस्ट्रिक्ट है राजस्थान में। तो उस दौरान मैंने मैडम जी कुछ प्रॉब्लम वहाँ पे आइडेंटिफाई की, और उस प्रॉब्लम में ये था मैडम जी कि जो हेल्थ अवेयरनेस से संबंधित है, जैसे कि मेरे कुछ ऐप्स हैं। जैसे पहला ऐप मेरा मैटरनल केयर का था। इसमें कंप्लीट मातृत्व सुरक्षा और शिशु सुरक्षा, जो ANC से लेके PNC, और साथ के साथ में जो शिशु की कंप्लीट केयर है, उसके बारे में मैंने जो अपनी लोकल लैंग्वेज यानी कि हिंदी में जानकारी दी। साथ के साथ में इसमें कुछ इंपॉर्टेंट कैलकुलेटर्स जैसे BMI, EDD और बेबी वेट, जैसे बॉडी मास इंडेक्स हो गया, एक्सपेक्टेड डेट ऑफ डिलीवरी हो गया, और जो बेबी का वेट कितना होना चाहिए अकॉर्डिंग टू एज, वो कुछ समायोजित किए। इसके लिए मैडम मैंने खुद जैसे W3 स्कूल है, HTML है, कुछ जावा कोडिंग से ऐप बनाना सीखा। इसके बाद में सेकंड ऐप मेरा मैडम इम्यूनाइजेशन का है। वहाँ मैंने देखा कि जो इम्यूनाइजेशन की है वो कंप्लीट इंफॉर्मेशन, जो मल्टी लैंग्वेज ऐप है मेरा, हिंदी और इंग्लिश में है मैडम। इसमें जो शिशु और मातृत्व का कंप्लीट इम्यूनाइजेशन है, बेबी का पर्सनल इम्यूनाइजेशन शेड्यूल भी है, और साथ के साथ में लेक ऑफ इम्यूनाइजेशन से जो डिजीज होती हैं वो भी कंप्लीट दिया हुआ है मैडम जी। इसके साथ मेरा अगर दूसरे ऐप की बात की जाए, जैसे यौन शिक्षा ऐप है, जिसमें STD सेक्सुअल ट्रांसमिटेड डिजीज जो है उनकी कंप्लीट जानकारी दी गई है, और साथ के साथ में सेक्सुअल मिसकंसेप्शन हैं उनकी भी क्लियरेशन दिया गया है। साथ के साथ उसमें कुछ कैलकुलेटर भी समायोजित किए गए हैं, जिसमें सेफ और अनसेफ पीरियड के बारे में डिटेल से बताया गया है। इस प्रकार मैडम अभी तक मेरे 9 ऐप्स हैं और मोर देन 8 लाख यूजर्स हैं, और एवरेज रेटिंग गूगल की बात की जाए तो आउट ऑफ 4.5 एवरेज रेटिंग है मैडम। कुछ मेरे मैडम जो स्टूडेंट हैं, नर्सिंग अभी मैं कॉलेज में हूँ, टीचिंग फैकल्टी, राजकीय नर्सिंग महाविद्यालय तिजारा अलवर राजस्थान में। तो कुछ मेरे जो स्टूडेंट के लिए अभी मैं ऐप पे कार्य कर रहा हूँ। तो नर्सिंग एग्जामिनेशन ऐप है मेरा मैडम जी, जो स्टूडेंटों को डेली ट्यूशन अपडेट करवाते हैं हम इसमें, और साथ के साथ में वीकली टेस्ट लेते हैं, जिससे हम स्टूडेंट की परफॉर्मेंस को एनालिसिस कर सकें। और अभी एक इग्नो से मुझे बेस्ट इनोवेशन
ब्रीफली आप कंक्लूड करिए, क्योंकि
हाँ, तो मेरा इनोवेशन बेस्ट मेडिकल ऐप है, जो मेडिकल अवेयरनेस से संबंधित जानकारी के लिए। थैंक यू सर, थैंक यू मैडम।
थैंक यू वेरी नाइस।
थैंक यू मुकेश। तो मैं डॉक्टर सुजाता ये बता रहा था कि जो एरियाज ऑफ इनोवेशन है इन हेल्थ सेक्टर, जिसमें अभी हेल्थ अवेयरनेस की मैं बात कर रहा था, एंड वी आर हैप्पी दैट वन ऑफ आवर स्टूडेंट हैज़ डेवलप्ड 9 एप्स फॉर क्रिएटिंग अवेयरनेस। इनफैक्ट ये बहुत ज़रूरी है, क्योंकि अगर अवेयरनेस होगी तो आई थिंक आप एग्री करेंगे कि हम हेल्थ इश्यूज आएंगे ही नहीं, उसको बहुत अवॉइड कर सकते हैं। तो मैंने एक हेल्थ अवेयरनेस का एक एरिया बताया। हेल्थ केयर डिलीवरी सिस्टम के लिए एक बहुत अपॉर्चुनिटीज़ हैं। इनोवेटिव प्रोडक्ट डेवलपमेंट के लिए बहुत पॉसिबिलिटीज़ हैं। डिजिटल हेल्थ केयर, जैसे आपने वेयरेबल डिवाइसेस की बात कर रहे हैं या और बहुत मॉनिटरिंग डिवाइसेस की बात कर रहे हैं, दैट इज़ ए वेरी अपकमिंग एरिया जहां बहुत ज़रूरत है। और आपने एक हाईलाइट किया था एक ऐप का, जो डीप लर्निंग एक्सपीरियंस, शेयरिंग द एक्सपीरियंसेस ऑफ डॉक्टर्स, बिकॉज डॉक्टर्स आर ऑल्सो हैविंग एक्सपीरियंस। अगर वो आपस में एक दूसरे के साथ कैसे कनेक्ट करेंगे, कैसे नेटवर्क करेंगे, देयर इज अ लॉट ऑफ अपॉर्चुनिटी फॉर डेवलपिंग इनोवेशन स्टार्टअप इन दैट फील्ड. एंड सिमिलरली अगर हम जो आपने कहा था कि टूरिज्म, मेडिकल टूरिज्म भी एक बहुत अपकमिंग एरिया है, एरिया ऑफ नॉट ओनली इनोवेशन बट ऑफ स्टार्टअप एंड बिजनेस इट इज कमिंग अप. We have seen many of people are doing this kind of medical tourism startups. And another area is a healthcare management system, because that healthcare management is also very important. आपकी डायबिटिक शुगर कब कितनी हो रही है, बीपी कितना हो रहा है, नॉर्मली हम उसको कहीं रिकॉर्ड करते हैं. देयर आर नंबर ऑफ एप्स कमिंग इन मार्केट जो कि आपको इजीली नॉट ओनली मॉनिटर करते हैं बट आपको गाइड भी करते हैं कि आपको ये करना है, ये डाइट लेनी है. सो दैट काइंड ऑफ अपॉर्चुनिटीज आर देयर. And another important area of innovation and startup in healthcare is the digitization of health data. Because health data किस सिचुएशन में कैसे किसने हैंडल किया, उसमें किस तरीके के आउटकम थे, क्या इनपुट थे, उन सबको एक तो डिजिटाइज करना, डेटाबेस बनाना, एंड देन यूजिंग दी. ओके, सो वी कैन टेक कॉल. यस प्लीज. आवाज कम आ रही है.
हेलो, आ रही?
यस प्लीज.
किस तरीके के आउटकम थे, क्या इनपुट थे, उन सबको
आप पीछे टीवी की आवाज भी आ रही है,
आपकी आवाज नहीं आ रही है हमें, और आपके पीछे जो टीवी चल रहा है शायद उसकी आवाज ज्यादा आ रही है.
आवाज कम आ रही है. हेलो.
हाँ जी.
यस, हाँ बोलिए. ऋषिकेश, आई थिंक.
Namaste, I am Dr. Prem Kumar Rathod. I am an oral and maxillofacial surgeon. I completed my hospital administration course from IGNOU. I am really honored to be here as a part of this program today. Oral and maxillofacial surgeons operates on the bones of the face, jaws, and this includes the bones around the eyes.
Could you please be a bit more loud so that we can get you properly?
Sure, ma'am. Sure.
Yes, please.
Am I audible? Namaste. Hello. Yeah. Namaste. I am Dr. Prem Kumar Rathod. I am an oral and maxillofacial surgeon. I completed my hospital administration course from IGNOU, and I am really honored to be here as part of this program. Oral and maxillofacial surgeons operate on the bones of the face, jaws, and this includes the bones around the eyes. Since face is the identity of the person, facial injuries have devastating effects on the patient's mental status and also social status also. Sometimes the bones of the face become so deformed or even delay in surgeries make operating these patients difficult. In such cases, intraoperative CT or intraoperative navigation may be required. These machines cost crores of rupees. To solve this problem, we at AIIMS Delhi has created a virtual surgical planning software. Without the use of such expensive machinery, using our software, we are now able to operate on these patients and get good results. I would like to thank my faculty, Dr. Ajoy sir, Ankila ma'am, Rahul sir and Krishna ma'am, and my seniors Dr. Bhaskar and Dr. Bhobalal. This method, by using virtual surgical planning software, our inbuilt software, was being used in AIIMS Delhi, and I took this as part of my thesis. We observed that patients had improvement in their facial bones, like they are looking more symmetrical, they have good eye movements, and they look better. Even their mouth opening improved, and their mental status and quality of life improved. They got free from the double vision and sunken eyes, and they are able to eat better and speak better. Our results of the surgery were equivalent to those when we use intraoperative CT or intraoperative navigation. We proved that we can operate on patients even without such expensive machinery and get good results. I would like to express my heartfelt gratitude to Dr. Om Prakash Sharma sir and the entire team of NCIDE IGNOU. They gave us a platform to express this innovation. NCIDE helps a lot and gives a lot of guidance. I'm excited about the positive impact innovation can have on healthcare and patients. I believe that such platforms provide an important space to promote innovation and startups. Once again, I would like to thank the organizers for this forum and the audience for your attention. I look forward to continuing the contribution to the advancement in oral and maxillofacial surgery and even in the healthcare sector. Thank you.
Thank you, Dr. Prem Kumar. Prem Kumar is also IGNOU student, and he was awarded with the Best Innovation Award by NCIDE. And he is continuing with his innovation, so we are happy to know that. And he is a faculty working at the Rishikesh AIIMS, I think, what he has introduced. So, and I think in this context, we may like to introduce another innovator student of IGNOU, Dr. Hamira Mullah. You can display her slide because Hamira is out of country right now, but we would like to highlight that she is a very innovative person, innovative doctor. She is a dentist by profession, and she was also awarded with the Best Innovation Award by the National Center for Innovation and Distance Education. During COVID time, she had identified an innovative mechanism to test COVID-19 infected persons through the presence of ACE2 receptors in oral tissues. And that was a very innovative work that done by her. So we are proud of her. Also, if she could connect, then we would have been very happy. लेकिन आई थिंक वो बाहर हैं तो इसलिए नहीं कनेक्ट कर पा रही हैं. एंड इन द सेम लाइन वी कैन इंट्रोड्यूस अनदर innovator student of IGNOU in the field of health sector, Mr. युगल किशोर. युगल किशोर ने भी मल्टी यूटिलिटी कॉन्टैक्टलेस अल्ट्रावायलेट डिसइंफेक्टिंग सिस्टम का एक प्रिपरेशन किया था, डेवलप किया था ड्यूरिंग द कोविड-19. इनफैक्ट कोविड-19 के दौरान हमने देखा कि हमारे बहुत स्टूडेंट्स ने हेल्थ सेक्टर की फील्ड में कई इनिशिएटिव किए, एंड दिस वाज वन ऑफ देम, एंड इट वाज गिवन द बेस्ट इनोवेशन अवार्ड दैट टाइम. So, and he is also a PG DRD student of IGNOU, and it is a fully automated, basically contactless disinfectant system, and that time development of this kind of system was very innovative, very important also. After that, luckily we are not in the group of that COVID-19. So, but innovative mindset is there. He identified the problem that time, and then thought of some innovative solution, and this kind of product was developed, and that was very useful also. So these are the innovations by IGNOU students. I was just talking about the area, so I would like to continue. That was the digitization of health data. That is very important. Lot of apps are being developed, and there is a lot of work to be done in that field. And that will not only help in connecting the different stakeholders, patients, doctors, nurses, and other community persons. So in a case, it will help in strengthening the health ecosystem in the country. And what you had highlighted, that was the customized and personalized apps or products or services. That is very important, particularly in case of geriatrics, or in the old age persons, or in case of children also. That kind of initiatives are required, and this is a very important area for innovation and startup in health sector. And remote patient monitoring, that is now not a new, but lot of innovations are still continuing. Lot is to be done, because we have seen sitting in the remote area, doctor can see the ECG, and then can give the prescription, also can give guidance. This kind of thing, they need to be strengthened. That is basically virtual therapy is also one of the area where a lot of work can be done. Home-based diagnostic test, it is now very common thing. You will find different kind of labs. They are coming to your home, collecting the samples, and then providing report the same day, very instantly. So that kind of areas of innovation startups are there in the health sector, and our students are also doing a lot of innovation in this field. Yes.
Thank you, Dr. Sharma. Before concluding, entrepreneurs do look for support for starting a business. So if you could briefly tell us what types of funding is available for healthcare startups.
Yeah, so there is a good news that we have a lot of organizations which support funding, especially for innovation, and two major organizations. One is WHO, not exactly funding but recognition. So they are always having some or the other, platforms, some or the other schemes in which you can do the, give your innovations for them, mainly for innovation, not for startup. And because then these can be inter-country, discussion on that, and it can be showcased. And also Ministry of Health and Family Welfare, in fact, the program is on just now. You can submit program innovations and best products or product innovations, and then this is placed on their website for after you submit it. So this is another great place where you get recognition. As far as funding is concerned, there are 2-3 organizations which look for funding in the case of healthcare. One is DRDO. DRDO supports and strengthens research base in the area of life sciences through the projects under grant in aid scheme to meet the national needs, especially of the defense services of the country. Then you have, of course, you all must be knowing about this. That is the DST, that is the Ministry of Science and Technology, Department of Science and Technology. They also have, they keep calling for proposals under various programs, various schemes, and they do give funding. Then we have ICMR as far as healthcare is concerned. You also, again, there are applications which are being invited at present. This is the latest website which I am showing for all the programs. So they are, applications they are inviting for establishing center for various programs. And so that is all I would like to talk about the funding agencies. You do have some private funding agencies, but I am not saying it here. You can probably search in the net.
In addition to this, BIRAC in Department of Biotechnology and also Ayush Mantralaya, they are giving a lot of funding in the field of health sector.
I think even the Pradhan Mantri Startup Yojana, that is another thing which is common for all, but of course it is also there for healthcare.
So now we are at the end part of this session. We are going to conclude this session, and before that I would like to thank our experts, Professor Kuba and Dr. Sharma. Thank you so much, and we thank our viewers for joining in, and we are also thankful to our Vice Chancellor for his guidance and support, and to our Pro Vice Chancellor for their support.
EMPC also.
I am also thankful to EMPC for the conduct of this program. So thank you all. Thank you very much.
Thank you.
We welcome you to join the bouquet of programs offered by the School of Humanities, the Indira Gandhi National Open University, New